Welcome to today's Practice Advantage Pearl. Today I'm paying special attention to residents and fellows as they take their first employment opportunity and talking a little bit about what are the differences in sites of service or employment opportunities. For example, academic centers, private medical groups, health systems, integrated delivery systems, and hospitals, and multi-specialty medical groups. Let's go through them real quickly at a high level and find out what the nuances might be between each of them. Emerging in today's marketplace are hybrids of these models, so you can pay attention to that as well. The academic center traditionally is around providing clinical care. A lot of times you get complex cases, also doing research and teaching, some of the main mores of that particular setting. The exciting part of being in an academic setting is the collegiality you have with other specialists, with like specialties, also new innovative therapies and technologies, and also the opportunity to try new business models. A great opportunity in the academic setting. Your salary and your benefits may not have as much variability, but nonetheless the opportunity and the intellectual rigor is there. Private practices, on the other hand, are based on either solo or small group practices or larger group practices, single specialty, meeting a need within a marketplace. A lot of times compensation opportunities are good on the upside, but also there's a higher risk on the downside. Decision making can be very nimble. Your partners may be people that you really enjoy that collegiality with, but again, it's single specialty focused on your particular specialty, whether it's urology, urogynecology, neurology, neurosurgery, spine, pain, PM&R. Health systems, integrated delivery systems, and hospital-based systems are becoming more and more prevalent in the employment opportunity place for new physicians graduating. Part of that is it's a known entity. Typically, the contracts are pretty straightforward, your employment agreements. Typically, there is coverage for you. If you need coverage, you're not having to worry about that as often. You will have to participate in some committees. That certainly comes with being a part of a large system, but your referrals are baked into the system as well typically. So within that network or within that health system, there are referrals already present in that particular system. Now we jump over to the multi-specialty group. So it may be a primary care base with additional specialists joining them, but the primary base is primary care. Opportunity is great because there are a lot of primary care doctors feeding you the specialist. What may need to happen is good education, especially if you're the first in your specialty, into that group on what are really appropriate patients that they should be referring to you within that particular practice. Typically, those practices are well run. They carry a little heavier overhead with them because they offer more from a benefit structure and those kinds of things. Also, in that particular type of setting, there's usually a hybrid compensation formula. There'll be a base salary that's guaranteed with some upside from productivity. So as you can see, at a general level, academic, private, health system, or multi-specialty, there are nuances there. You need to think about how your personality might fit into those, and undoubtedly you'll be exploring one or two or more of those models as you look for your first employment opportunity. Thank you for joining us for today's Practice Advantage Pearl.